All right, our next speaker is Dr. Harvey Bartnof. Dr. Bartnof is a graduate of the University of California, San Francisco Medical School. He's board certified in anti-aging medicine. He's a former clinical professor at the University of California, San Francisco Medical School. And his topic is going to be telomerase. So will you please help me welcome Dr. Bartnof? I will give you a 10-minute sign.
10-minute sign. Okay. Sounds good.
Want this one? It's easier.
Yeah. Oh, okay. And where's the, oh, that one. Okay, great. Great. Thank you, John. And, oh, sorry. Thank you, John, and thank you to A4M and University Compounding Pharmacy for the opportunity to speak with you about this very interesting topic, telomeres and telomerase. Just by quick show of hands, how many of you feel knowledgeable about telomeres and telomerase? Raise your hands. Not very many, a few. Okay. How many people here are taking a supplement that's activating their telomerase, a telomerase activator supplement? How many people? A few. How many people wouldn't feel comfortable saying that they were taking a telomerase activator in a public setting? Nobody's raising their hand. Few people. Okay. All right. What we're going to do is go over some very, very interesting information. This area is a very interesting topic, and I think you'll find it quite fascinating. Outline, we're going to even talk about why talk about telomeres. We'll define telomeres and telomerase, associations in humans between shorter telomeres and longer telomeres. Mouse studies in terms of telomerase being blocked, mice and human studies where telomerase is activated, or when a supplement is given. We'll go over a couple case studies at the end and talk about the future. Just as a background, I feel it's always helpful to look at, do we have a pointer here, John? Oh, there's my pointer. Okay. Here we have a whole seminar about bioidentical hormone replacement therapy, and really I think it's important to take a step back and look at how that fits into the whole concept of anti-aging medicine or age management medicine, which of course involves all these different areas. And preventive regenerative medicine, as the topic has come up several times over the last few days, it's going to involve the right combination of vitamins, minerals, nutraceuticals, lack of toxicities and inflammation, and integrative medicine, which is going to include nutrition, exercise, stress management, and for many patients, spirituality, resolved abuse, and all these things really make up a component of health, wellness, and disease prevention under the general heading of age management medicine. And the take-home message is that telomeres and telomerase literally affect every one of these circles in this Venn diagram. According to Greek mythology, the goddess Eos asked Zeus to grant immortality to the Trojan Tithonus, her mortal lover. But Eos had forgotten to ask for eternal youth, so Tithonus received the gift of immortality and continued to age, withering beyond recognition and begging eternally for death. How many of you have family members or patients who may have indicated that to you? In aging, humans, as in many species, represents a progressive loss of metabolic and physiologic functions, though the trajectory for this is not uniform, indicative of an underlying inter-individual variation in the biology of aging. As a little bit of history, there was something realized that there was a problem with the chromosome tips that goes all the way back to the 1930s, when Mueller and McClintock noted that the chromosome tips lacked the stickiness that normally happen when chromosomes break. It was indicating there's something protecting the chromosomes at the tip. In 1971, Alevnikov described this as the under-replication problem, or marginotomy, where the telomeres were unable to replicate themselves in successive passages. In 1972, James Watson of Watson and Crick fame noted that DNA polymerase could not copy linear chromosomes all the way to the tip, and there was a small region that was uncopied at the tip, a piece of the telomere. And I'm sure, familiar with the Hayflick limit. Leonard Hayflick described that when you have cells in vitro in the test tube, with time, they stop growing. After about 50 divisions, they won't divide anymore. And this was reported several decades ago. So over the last 30 years, there's been a lot of research in the area of what we call telomeres and telomerase. And in fact, in 2009, the Nobel Prize in Physiology or Medicine was awarded to 3 researchers for the discovery how chromosomes are protected by telomeres and the enzyme telomerase. Professor Elizabeth Blackburn, whose office is just a couple miles from here at UC San Francisco School of Medicine, Dr. Carol Greider, who's at Johns Hopkins, and Dr. Jack Sostak, who's at Harvard. So telomeres are the tips of the chromosomes that shorten as we get older. So here's a typical picture of a chromosome in metaphase with the tips here, and a cell divides into 2 daughter cells, and there's a little bit of the telomere that's lost at the end. And those 2 daughter cells divide into the next generation daughter cells, and a little bit more is lost, and so on and so forth, so that we get to a point where there's not enough telomeres to protect the chromosomes, and there's risk of chromosomal instability. So here we see telomere shortening, loss of function of the telomeres, and where DNA damage proteins are generated. And what will happen is either senescence, where the cell stops growing, associated with other abnormal physiology, or apoptosis may occur, programmed cell death. So the telomeres protect the DNA, they prevent the DNA from abnormal erosion, abnormal recombination, abnormal fusions. All these, of course, are associated with abnormal functioning of the blueprint of the genome, and, of course, increased risk of cancer if you don't have intact blueprint of the original genome. But there are other functions as well, as we're learning. They help to maintain the mitochondria, which, of course, are extremely important from the standpoint of maintaining energy. So it's usually described as the aglet, which is the tip of the shoelace is shown here, with an intact one versus one that is not intact over here. That's okay. We don't need to. It's probably a little bit of an oversimplification, but it's a concept that I think is useful. So how important are telomeres? This is Professor Blackburn. Quote, telomere shortness is associated with just about all of the major diseases of aging, from cardiovascular disease, death from cardiovascular disease, risks of cardiovascular disease, diabetes risks such as insulin resistance, vascular dementia, to osteoarthritis, end quote. She goes on to say, the list goes on, and the correlation is always in the same direction. Shorter telomere length is associated with more disease. The association is absolutely solid now because it has been found in so many cohorts that it cannot be a statistical accident. Dr. Rodrigo Collado from the National Institutes of Health, writing in the New England Journal of Medicine, quote, telomere dysfunction seems to underlie the development of a range of human genetic, degenerative, aging diseases, and cancer. And the number of abstracts about telomeres has exploded. Actually, original syllabus, we did not have telomerase. When you add in telomerase, it's 19,000. If you put in menopause, you get 48,000. I mean, a third is many. And if you look, menopause has been around since Adam and Eve, although I don't think Eve made it to age 51. So, courtesy of Bill Andrews, here's our metrosexual San Francisco gentleman, and zoning in on his skin cells and on the nucleus of A skin cells, where you can see some chromosomes and one chromosome in metaphase. And those are the telomeres at the tip. Telos refers to end, and meros, which means part. So following this further, if we have a chromosome here and unraveling the very end, we see the double-stranded DNA, and then ends in a single-stranded DNA because of the inability to copy the opposite strand. And following it to the end here, following it to the end here, there's a T-loop to help protect the chromosome. And there are groupings of what's called Shelterin complex. These are various protein molecules that are a part of this. And the bottom line is if there are mutations in any of these proteins, or there is abnormal structure, then there's going to be a problem with telomere function. So courtesy of Bill Andrews, that's age 20, age 40, age 60, age 80, and telomere shortening. So telomeres shorten with aging. This is a typical graph of what we would see if you plot by age. So here we have on the x-axis age 20, 40, 60, 80, and 100. And telomere length here is in kilobases. So at conception, there are about 15,000 base pairs, and we lose 5,000 until we're born, when there are about 10,000. So here's 10,000 over here at delivery. And a lifespan, we lose about 5,000 to 10,000 base pairs, or approximately 50 to 60 on average per year, although obviously that can go much faster, as we'll get to in just a moment. Senescence, or apoptosis, of cells happens when the lengths are roughly 3,000 to 5,000. The top grouping here is the granulocytes, which tend to have a little bit longer telomere lengths, and the lymphocytes are a little bit shorter. Most of the tests are done using peripheral blood leukocytes or lymphocytes. One of the labs, and I'll be happy to give the specific information, although there was a booth here representing one of the labs that does the telomere test, but CME regulations don't allow me to say the name, where they'll give the report of the telomere length by percentile. So here this individual, roughly age 49, has a telomere that's going to be roughly the 75th percentile in terms of the length. So telomere length in general decreases as with aging, and it's related to loss of the telomerase enzyme, which helps to extend the telomeres. Now, there are some exceptions to that. The germ cell lines, the ovaries and the sperm, maintain telomerase. So there's no shortening of the telomeres in the sperm or in the eggs, as we know. For all the rest of the cells in general, the somatic cells, there's a relative decline with age. In certain settings of cancers, telomerase may be reactivated, and we'll come back to that in a little bit. And there are premature aging syndromes where telomeres are lost very fast and lead to diseases, and we're going to come to that also. So telomeres decline, including the immune cells. So this is germ cell line, maintains the telomere length, but here's stem cells. If your stem cells' telomeres get shorter and shorter and shorter, eventually you can't generate new cells to come from the stem cell. So that's going to be a problem. There's a myeloid and lymphocyte-derived cells. Of all the PowerPoints we're going to see during this 50 minutes, I would say this is the second most important one. Because if you don't have immune function, you can't control a lot of things, whether it's infection or cancers and so forth. Another concept that has emerged, in addition to general decline of telomeres with aging, is the percent short telomeres. Percent short telomeres. So this is important because it turns out that as we get older, the percent short telomeres becomes more and more of an issue. And the telomeres don't shorten to the same degree in every cell or even on every chromosome. And as you probably heard at one of these seminars, or if you attend the fellowship, we hear the statement that we're only as young as our oldest part. We're only as young as our oldest part. So if we have a lot of short telomeres that put us at risk for genomic instability, then that's going to be a major problem. So percent short telomeres is another test that can be done. There are more differences between individuals than the mean length. There's more dispersion with aging, and it's possibly more reflective of lifestyle. So percent short telomeres can be plotted here on a lab report. Here's an individual, again, about age 48, who has a telomeres roughly going to be the 60th percentile. Same lab will report an estimated biologic age based upon percent of short telomeres. Here they'll use the cutoff at roughly 3,000 base pairs. So if the individual here is age 60 and they have a biologic age of their telomeres at 42, they're doing pretty good. On the other hand, if they're 35 and you get the test and it's showing a biologic age of 42 on that parameter, they have significant aging of that aspect of their immune function. So what is telomerase? A natural enzyme that helps to extend telomeres, discovered in 1985. When telomerase is activated, it adds DNA bases at the ends of the chromosomes. It allows cells to live longer and revert to a more youthful profile or youthful phenotype. Telomerase preferentially extends short telomeres, has been shown in a number of studies. Telomerase is active all throughout embryogenesis, and then in the vast majority of somatic cells is turned off at delivery. So this is a cartoon of what telomerase would look like. It's composed of a structure here that is going to have the telomerase reverse transcriptase enzyme, the telomerase RNA component, and a discarin protein, and it allows the base pair to be added on to the growing end of the telomere as shown here. So in a cartoon from Woody Wright, telomerase is able to add on individual nucleotides to the end of the telomere when it's able to be functioning. So telomerase would extend the telomere. So that was the first part where we were just kind of doing an overview and some definitions. We're now going to talk about some of the epidemiologic or population-based studies that are really show some of the importance of telomeres. So the first study that came out in 2003, Dr. Cawthon, University of Utah, 143 normal, unrelated people over age 60. They were followed for 15 years. And it turns out he just divided the telomere lengths into the upper half and the lower half of length. And those who had the shorter telomeres were twofold greater likely to die from all causes, women slightly more, men slightly less, threefold increased risk from heart disease, and eightfold increased risk from infectious disease, and 1.5-fold increased risk for stroke and for cancer. And they concluded, quote, "These results lend support to the hypothesis that telomere shortening in human beings, contributes to mortality in many age-related diseases." And this is the Kaplan-Meier survivor curve. So those that are surviving after 15 years, if they had the longer halves, were surviving longer, and those shorter were not surviving as long. And there was no significant difference by gender or by age. Another study, 175 pair of twins from Sweden. So if you do twin studies, then that would attempt to factor out predisposing genetic factors related to telomere. These individuals, mean age of 79, so an older crowd, followed up for about 7 years, a maximum of 11 years. And the twins with the shortest telomeres had threefold greater risk of death than their co-twin with the longest telomere measurement. So that's shown here on the Kaplan-Meier survivor graph here, going out to 11 years. This is proportion surviving. Those with the longest telomeres lived longer than those with the shorter telomere. Again, they were divided into quartiles, as you can see here. A much larger study, heart and soul study here at UCSF. 780 patients, 81% men, average age 67 years, followed up for a mean of 4.4 years. Patients with shorter telomeres had twice the risk of cardiac death as patients with the longest telomeres. So this is patients with stable coronary artery disease, and that's how they got into the study, whether it was angina, abnormal treadmill, abnormal cardiogram. And those with the shorter telomeres had twice the risk of death when corrected for or adjusted for known risk factors, age, all the cardiac risk factors, C-reactive protein. And the results are shown here that, again, those with the quartiles, the longest quartile of telomere length lived the longest, and those with the shortest did not live as long. What about cancer? This is a 15-year prospective study where there were 2 separate telomere measurements. 1,000 people, much larger study, mean age 63, 787 were free of cancer in 1995, and 558 were free of cancer in 2005. So at the end of 15 years, 137 were diagnosed with cancer, and 62 died from cancer. So those in terms of cancer, those with the shortest telomeres, when divided into tertiles, had a threefold increased risk of having cancer. For cancer death, there was an eightfold increased risk of dying from cancer with the dose-response relationship. So the shorter the telomeres, the greater the risk. And this was adjusted for varying factors. So this is the cumulative hazard. This is shown in the opposite direction, the hazard of developing cancer. The longest tertile had a much lower risk than those in the shortest. And cancer mortality, this is almost a tenfold increased risk. This is probably the third most important PowerPoint of the day. This is a dramatic difference. Longest tertile of telomere length and the shortest over 15 years that they had over tenfold increased risk of dying from cancer. They concluded, quote, "Our study shows that short telomeres are associated with an enhanced risk of cancer and fatal cancer in particular," published in JAMA. A large meta-analysis of cancer deaths. So this is 11,000 patients, 13,000 controls from 21 publications, and a odds ratio bar here, that 1.35 increased risk of dying from cancer for those in the shorter telomeres. And it was the same results whether there were cancers associated with smoking, digestive system cancers, or urogenital cancers. So aside from the population-based studies, are a number of studies looking at other cofactors that are involved in shorter telomeres, and we're going to look at some of those now. And one is stress. This was done looking at the caregivers of Alzheimer's patients. 41 caregivers, 41 controls, men and women. Caregivers had significantly shorter telomeres than their controls. These findings demonstrate that chronic stress is associated with altered T-cell function and accelerated immune cell aging as suggested by excessive telomere loss that was equivalent to about 4 to 8 years of a shortened lifetime. More stress, mothers of ill children. These were premenopausal women, average age 38, taking care of an ill child, or control mothers taking care of healthy children. And this was looking at duration of caregiving years. This is all the way out to 12 years, showed an inverse relationship. The longer they were taking care of an ill child, the shorter their telomeres were. When you ask the mothers to rate their stress, there are standardized scales for this. The higher the stress that they reported on the scales, the shorter the telomeres. Cumulative days of lifetime depression. Many studies about depression and shorter telomeres. This is one here at UCSF, Dr. Wolkowitz as well. Why is that happening? So this is cumulative number of days of depression, clearly increasing number of days of depression, shorter telomeres. Depressed subjects with more than 9 years of cumulative depression exposure had telomeres that were 281 base pairs shorter than the control, equaling 7 years of accelerated cell aging. Poor sleep quality in women. No surprise, we see patients all the time. This is 245 middle-aged women. They were asked to rate their sleep on the Pittsburgh Sleep Quality Index Scale, one that we use for every new patient at our institute. And just by rating their sleep quality, fairly bad, fair, fairly good, or good, if they rated their sleep as good, they had longer telomeres. And if it's fairly bad, shorter, with a dose-response relationship. And highly significant, adjusted for known risk factors. Now, it's interesting, this article didn't ask or report on vasomotor symptoms, which obviously is going to be a cofactor. But nonetheless, the sleep is important. Other cofactors, lack of exercise. A number of studies have shown this. The twin epidemics of diabesity. So here's our gentleman with his 64-ounce big gulp and maybe wearing some Depends. So diabetes itself, leukocyte telomere length, is associated with complication of type 2 diabetes. Telomere deficiency impairs glucose metabolism and insulin secretion. Shorter telomeres are associated with obesity and weight gain in the elderly. Inverse relationship between adiposity and telomere length. And even in children, childhood obesity is associated with shorter leukocyte telomere length in the children. If you look in the adipocytes, the fat cells of people who are obese, the telomeres are shorter compared to people of a normal BMI, and looking in their adipocytes. Inflammation. So this is a recurring theme over this seminar. Dr. Rothenberg, I'm sure, has spoken about this. Here's 2,000 patients in the Health Aging Body Composition Study. Cumulative inflammatory load indexed by a combination of high interleukin-6 and TNF-alpha were associated with increased odds of short telomere. Those who had the highest IL-6, TNF-alpha, and C-reactive protein had an odds ratio of 1.7 of having a lower telomere length. Quote, first large-scale demonstration of links between inflammatory markers and telomere length in an older population. Dr. Blackburn was a co-author on that. So those are some of the social-related factors. There turn out to be a number of telomere diseases that are specifically genetic, and we're going to look at a couple of those. Dyskeratosis congenita, or DC, is a premature aging syndrome. They have mutations in the telomerase enzyme. This leads to decreased telomerase stability and shorter telomeres. They have short stature, hypogonadism, infertility, bone marrow failure, and blood defects. Skin defects, we'll look at more in just a moment. Increased cancer and infections, early hair loss or graying, osteoporosis, cirrhosis, pulmonary fibrosis, and premature death. There's actually a mouse model of DC. Here's the researchers, they get excited. Pot of gold modeling DC in the mouse. So dyskeratosis congenita has these typical nail dysplasia or abnormal morphology there. Come on by age 10, as well as leukoplakia, white spots in the cheek and on the tongue. And also skin pigmentation changes, this sort of this reticular pattern. I'll bet you've seen this on patients and you thought maybe it was due to sun exposure. So they have gene mutations in the RNA component and dyskeratin, decreased telomerase, shorter telomeres, and premature death. Another is Werner syndrome, is another premature aging syndrome. This is a patient who's age 34. The average patient dies in their 50s. These data demonstrate for the first time that telomere loss is accelerated in organs of Werner patients, suggesting that abnormal telomere erosion is one of the major causes of early onset of age-related symptoms and a predisposition to sarcoma and carcinoma, as well as diabetes and cataracts. They actually have a gene mutation in their helicase gene, which thereby will affect the telomeres. And there's also a mouse model. Idiopathic pulmonary fibrosis is what's called. When I went to medical school, turns out it's not so idiopathic anymore. Kind of a strange term, I always thought. Disease from itself just means we really didn't know what the cause is, but now we do. Short telomeres are a risk factor for idiopathic pulmonary fibrosis. Proceedings of National Academy of Science and New England Journal of Medicine. It's a typical CT scan of someone with obviously very, very abnormal lung structure. With scarring, they only survive about 3 years after diagnosis, and they have shortened telomeres as a common cause, whether it's in the TERT or the TERK enzyme. Aplastic anemia. So aplastic anemia, this is what the bone marrow looks like, acellular compared to normal bone marrow over here. They don't have any stem cells left because the stem cells, the telomeres have gotten shorter and shorter and shorter, and sooner or later they can't make enough of the cells of the blood element cells. A third of the patients with aplastic anemia have short telomeres. They have a mutation in TERT or TERK and low telomerase. And just a little foreshadowing, a lot of these patients are treated with, anybody? Testosterone, right? Testosterone increases telomerase and allows red cell elements to come back. So telomerase diseases, in a review in Nature Genetics in Medicine. So this is our typical telomere graph by age and telomere length. So dyskeratosis congenita, they're way below the first percentile. Aplastic anemia at roughly the first percentile. And idiopathic pulmonary fibrosis, a little just under the 10th percentile. So very abnormal telomeres. So in the summary of this part, this is really sensitive here. Summary of this part, there are genotype and phenotype manifestations and correlations, whether there are gene mutations in these various telomerase genes that may lead to dyskeratosis congenita, other specific genes that may lead to aplastic anemia, pulmonary fibrosis. We won't have time really to talk about certain leukemias or liver disease. So as telomeres get shorter, there's more disease, and of course aging is going to be part here, as we're going to come to here. Now those are uncommon or less common diseases, but it turns out there are, of course, many diseases that are associated with short telomeres, atherosclerosis in particular. Here's from Circulation Research, quote, "We conclude that human atherosclerosis characterized by senescence of vascular smooth muscle cells, accelerated by oxidative stress-induced DNA damage, inhibition of telomerase, and marked telomere shortening." So, of course, atherosclerosis, the number 1 and 3 cause of death. So, prevention of cellular senescence may be a novel therapeutic target in atherosclerosis. Shorter telomere associations are associated with earlier death. And by the way, the references were left out of your original syllabus. If you want the original references, you can send me an email and I will get them to you. Shorter telomere, people die sooner. Associated with older age. Male gender, men lose their telomeres faster than women do, except the Amish. Probably due to no alcohol and no tobacco, which of course associates with oxidative stress and inflammation. Caucasian race have shorter. Turns out African Americans in general lose their telomere lengths faster, although probably going to be social factors there as opposed to genetic factors. Father with an early heart attack. If that's your father, you're going to have shorter telomeres because that was a predisposing factor for him getting the heart attack at an early age. Certain genetic polymorphisms. Various environmental, physiologic, and psychological stressors. Stress itself will shorten the telomeres, and this has been shown to be related to cortisol, which of course has been a topic at this seminar. It turns out that too much cortisol will shorten your telomeres, and too little cortisol. So the old paradigm of having an optimal amount of the hormone, not too much and not too little, would apply also in terms of telomeres. For women, current employment and work schedule turns out to be they have shorter telomeres. Child institution, children at orphanages have shorter telomeres than control patients. Or childhood trauma, depression, many studies. Poor sleep quality, less sleep in women, obstructive sleep apnea. Migraine in women, less education. Low physical activity, smoking cigarettes, polycyclic aromatic hydrocarbon exposure in the workplace mostly. Cardiovascular disease, there are many, I'd say not all studies, but I would say the majority clearly show increased risk, whether it's hypertension itself, heart attack, heart failure, atherosclerosis, abdominal aortic aneurysm, where they find lower telomerase in the aneurysmal pathology compared to 2 centimeters away. Carotid disease and stroke, although not all studies. There are also studies that have measured the telomere lengths at the atherosclerotic lesion, where the telomeres are shorter than just a centimeter away when there's no atherosclerosis. Diabetes, as we've gone through, obesity, cancers, osteoporosis in many but not all studies. Osteoarthritis is a very interesting study. Knees were removed as a part of knee replacement, and on the surface of the tibial plateau, the area where there was the greatest amount of erosion had the shorter telomeres compared to an area just 1.5 centimeters away. And that area with the greater erosions also had a higher percentage of short telomeres. Rheumatoid arthritis in most studies, hepatic cirrhosis and progression associated with mutations. The inflammatory diseases in general, things are turning over faster due to inflammation, and that shortens the telomeres faster. Chronic obstructive pulmonary disease. The neurodegenerative diseases are a little bit more of a mixed study, mixed group of reports, I would say, where not all studies will show that. Chronic kidney disease, disability in the elderly. And these, by the way, they've corrected for the known risk factors, whether it's body mass index, age, and so forth. Cataracts, periodontitis, other inflammatory conditions on the skin, atopic dermatitis, psoriasis, of course, telomere mutations. And inflammation and oxidative stress has been individually reported and is probably going to be a common cofactor for a number of these associations. Chronic infections turns out also to be a big one. People who have CMV infections, cytomegalovirus, HIV, Hep C, and Hep B turn out to have shorter telomeres. Ovarian insufficiency, also associated with low telomerase. And mitochondrial dysfunction. Response to medications. Cancer chemotherapy will shorten the telomeres. These we've talked about, the less common conditions. Graft versus host disease. Stem cell transplant recipients have shorter telomeres. Dolly died sooner because the donor nucleus had shorter telomeres. So those are some shorter telomeres associations. What about longer telomeres associations? Well, it turns out one is fish oil. People who take fish oil regularly, in general, are going to have longer telomeres, and they will shorten more slowly with higher levels of fish oil. So this is the Heart and Soul study, followed for 6 years. This is quartile of fish oil, and this is the change in telomere length over time. So those who had the highest quartile of fish oil in their blood had a 3% decrease when followed over 6 years, compared to those in the lowest quartile had a 8, almost 9% decrease in their telomere length. So hormones, of course, are going to also be involved with telomere length. So we have a whole seminar that we're concluding about bioidentical hormone replacement therapy. So this is women, this is men, this is estrogen. Of course, it starts to decline at menopause. Men, testosterone starts to decline about roughly age 30. DHEA declines with aging. IGF as a marker of somatropin or growth hormone also declines. Estrogen substantially decreases with advancing age in both men and women, protects against multiple aspects of cellular aging in rodent models, including oxidative damage, telomere shortening, and cellular senescence. So estrogen will turn on TERT, telomerase reverse transcriptase. This is a study of 130 postmenopausal women who were on hormone replacement therapy matched to 65 controls, and the intervention patients had been on hormone replacement therapy for over 8 years, and they found that telomere lengths were longer in postmenopausal women who had a history of long-term hormone therapy than in postmenopausal women without it. Long-term hormone replacement in postmenopausal women may alleviate telomere attrition. So longer telomere associations are associated with longer quality of life, improved health span, younger age, female gender, except the Amish, flip side of the shorter ones, obviously. This is interesting. Increasing paternal age at birth. So this might seem to be sort of paradoxical, because as we get older, the telomeres get shorter and shorter. If you have a father who is older, you're going to have longer telomeres. How could that be? Well, there are compartments of telomerase and telomeres, and I said before, the germline, telomerase is constitutively turned on, and it turns out that over time, the male sperm actually can have even longer telomeres for an older father than a younger father. Actually, they've calculated out 17 base pairs per year longer per increasing year of age of your father. Increased physical activity is associated with longer telomeres in most studies. Increased education, smaller waist circumference in women, normal weight, increasing dietary fiber in the diet for women. We just talked about the fish oil. Lower intake of the polyunsaturated fatty acids in women, so avoid those omega-6s. Daily multivitamin in women. Vitamin D itself will increase telomerase. Of course, vitamin D is a corticosteroid. Vitamin E, including tocopherols and the tocotrienols, are associated with longer telomeres. Vitamin C, N-acetylcysteine, of course, is going to be affecting oxidation. Resveratrol is sort of more of a mixed group of studies. Some of them will show increased telomerase, others show decrease. So I would make a notation on your, as I added in additional. Thank you, John. Endometriosis, interestingly enough, is associated with longer telomeres. Lupus is sort of a mixed story. Hormones, IGF in men and women is associated with increased telomere length. We've talked about estrogen and testosterone. The Dr. Dean Ornish program of meditation and lower eating better with a healthier lifestyle and meditation is associated with increase in telomerase. A mindfulness intervention for weight loss at UCSF has been associated with increased telomerase, and telomerase activation supplement has been shown to decrease percent short telomeres. So the latest comment on Match.com is, my, what big telomeres you have. So that's some of the human data. On the mouse data, it's very, very impressive. I don't condone animal research, but others do it, and I'm just going to report it here, that when you block telomerase, they age faster. So this is a control mouse, age 21, and this is a mouse where telomerase has been blocked. At only 18 months, you can see how much older that they look with loss of hair here and graying of the hair. So they get premature gray and thinning, delayed wound healing, less fat underneath the skin, spleen size is smaller, less marrow cell proliferation, the intestinal villi will atrophy. They do actually have increased cancer, increased chromosomal abnormalities, of course, because the telomeres are shorter, and the males become infertile, and they don't live as long. So this is showing the survival curve. This is control mice. This is the first generation of those who have had their telomerase block. They don't live as long. Instead of 30 months, they live 30 to 25 months. Second generation, they only live 18 months. And if they're third generation, they only live 10 months. So this is what happens when you block telomerase. So is it possible that telomerase activation could delay or reverse aging pathologies? So Dr. Maria Blasco, who's now in Spain, showed that when you add in the telomerase enzyme, the mice live longer and are healthier. So this is a wild-type control mouse, aged 2 years, and here's where the TERT enzyme has been added in. And increased survival at 3 years, 3% up to 42%, increased glucose tolerance, and increased fat underneath the skin. Their telomeres are longer. They have decreased short telomeres. And the mouse says, thank you. Their neuromuscular function is better. In a tightrope test, those who have the telomerase added in when they're 2 years old, they can all get across the tightrope. Whereas 2-year-old mice who don't have the telomerase, half of them will fall off. So in mice, altogether, the analysis of a variety of aging-associated pathologies, biomarkers of aging, and molecular markers of aging strongly indicate that telomerase improves organismal fitness and delays aging. Another mouse model, this was done by Dr. DePinho at Dana-Farber. This is a control mouse, and this is telomerase knockout mouse. What they did was they then reactivated telomerase just for 4 weeks. They had a very interesting enzyme gene system where they activated for 4 weeks. And then they assessed them 1 month later. Telomere length significantly increased. Atrophic testes grew back to almost normal size. Male mice gained fertility. Atrophy in the spleen, liver, and intestines improved. It reversed brain aging. They had larger brains, increased myelination, and the cells that make the myelin, oligodendrocytes, improved and increased neurostem cell regeneration. I'll show you a picture of that in just a minute. Sense of smell returned. I mean, older folks, they say, I'm just not smelling right anymore. Well, here, the same thing happens with the mice. And reactivate telomerase for 4 weeks. Sense of smell returns. No cancer, and increased lifespan, increased from 20 to 60% survival at 1 year. The author from Harvard says, quote, a near Ponce de Leon effect, published in the journal Nature. So this is the brains here. This is the control. This is after 4 weeks of telomerase activation, clearly increase in size that they show here. This is the myelin sheath that insulates, of course, the neural tissue that here you can see is much narrower when compared to those that had the telomerase reactivated for 4 weeks. So in that model, they found that the model of accelerated telomere loss can be reversed within 4 weeks of reactivating telomerase. This raises the major question of whether physiologic aging, likely caused by a combination of molecular defects, may also be reversible. So how else could we activate telomerase? Well, it turns out there's a supplement, telomerase activator, that comes from astragalus, is a Chinese herb that's been around for 2,000 years. And safety data were done in rats and in mice. No increased cancer in a xenograft model. Ames mutagenesis test, no carcinogenesis. Safety data, you can read all this in your syllabus about what enzymes are upregulated by the TA supplement. And what they did was gave mice, these are just regular old mice, there were no genetic modifications, just old mice, and gave them 4 months of this telomerase activator supplement in their chow, in their food. And they found that it decreased the percent of short telomeres, improved glucose uptake, increased subcutaneous fat content, wound healing was improved, hair growth was improved on a plucking model, I'll show you that, and bone density improved. Lifespan was not changed. This was the hair plucking. So this is a year after they took 4 months of this telomerase activator, and then they plucked some of the hairs here, okay? And then 2 weeks later, this is the control mice, and this is those that had the telomerase activator quite some time before. This is published in Aging Cell. So those are the animal models. What about telomerase activation in humans? So this was published, a natural product, telomerase activator, as a part of a health maintenance program in rejuvenation research last year. And this was the proof of concept model that by adding in the activator in test tube in vitro, you could get increase in telomerase activity with certain concentrations. This was skin cell keratinocytes. This is human fibroblasts. Again, test of concept. So this study was published about humans taking this telomerase activator for a year. The interim data was published, 72% men, average age 63, and you can read all the baseline information there. And what they found that before they even took the TA65, they divided them into those who had past infection with CMV versus those who had not had past infection with CMV. So the CMV positive patients had significantly shorter telomeres, 680 base pairs, equaling accelerated aging of 10 years. Now CMVs, you may recall, common viral infection. 30% of kids by age 10 are CMV positive, then 1% per year are CMV positive. So 80% of 80-year-olds have had CMV infection, 90% of 90-year-olds. So this is a common infection. CMV positive patients also had higher senescent cells. So senescent cells are those that increase as we get older, that can't respond to new infections. It's a marker of immune aging. And they had significantly lower naive cells that are ready to respond to new infections. Those go down as we get lower, as we get older. So what I've just described to you is shown here in graph form. This is the naives, the decrease. So after 1 year of taking TA, the telomerase activator, there was a significant decline in the percent of short telomeres. Significant decline in the senescent cytotoxic cells, an age reversal of about 5 to 20 years in that biomarker. There was no change in the naive cells. The mean telomere length was a non-significant decline, although 39% did show an increase. Completely safe, basically zero side effects. This is showing the significant decrease in percent short telomeres here. And what I described in graph form, decrease in senescent cells, age reversal of 5 to 20 years, and the decline in the senescent cells. Quote, the decrease in percent short telomeres we found makes upregulation of telomerase by the telomerase activator the most likely mechanism for this salutary effect. Telomerase preferentially lengthens the shortest telomeres. We conclude that the protocol lengthens critically short telomeres and remodels the relative proportions of circulating leukocytes of immunocompromised subjects toward the more youthful profile of non-compromised subjects. Okay, all right. So safe. Telomerase does not cause cancer. It's a response to cancer or short telomeres. Telomerase does not induce changes associated with a transformed phenotype. Absence of cancer associated with changes in human fibroblasts. Telomerase is not an oncogen, and all number of tests to show that. Let's do one quick case, and then we'll be done. Okay?
I give him a break.
Break or case?
Case. All right, case wins.
Sorry. All right. So this is a patient who came to our institute, which is just a block and a half from here. Very convenient. So patient is a 53-year-old male physician. This is a real patient, not me. He presented in 2009 with fatigue, libido decline, anxiety, depression, subtle memory changes, and increased abdominal fat. Typical 53-year-old male physician, huh? Past medical history for obstructive sleep apnea, using CPAP successfully. Past history of Peyronie's, bent spike syndrome of the penis with erection. Of note, he was not overweight. His body mass index was normal. And so you'll miss a lot of apnea if you assume they have to be overweight or obese. So we diagnosed him with having andropause, osteopenia. He was treated with a full spectrum of bioidentical hormone replacement therapy, complete vitamin, mineral, nutraceutical regimen, and lifestyle. Doing extremely well, improved, except for occasional insomnia. So we got his telomere test. So this is increasing age. So he's 53. This is the telomere length. His length came out 5.5 kilobases, which is a percentile that's 12th percentile. What physician is used to having anything at the 12th percentile? He was not a happy camper, to say the least. So we did immune subset analysis. This was done at the lab at UCLA. And I will point out the salient features here. Remember I said that the senescent cells will increase as we get older, so you can measure that marker of immune aging. And sure enough, this is his immune senescent cytotoxic, and his level was 553 cells, higher than the upper end of the reference range. It was 364. Also, his natural killer cells were at the higher end of the range. It turns out most labs, when you measure it, natural killers actually increase because the function of each cell decreases. So the body responds by making more. So he had an older parameter measurement of this marker. His naive cells, remember I said those go down with aging? He only had 65 naive cells with a range of 32 up to 347. More unhappiness. I told him, don't get too depressed. It's going to make your telomeres get shorter. So what would you do? Stress management. He saw this, and we talked about stress a long time, actually. He shortened his work days, and he got an assistant to help him do some of his work. Any other tests that you'd get? You have the answers there, so. His short telomere test is pending. We're just able to get that fairly recently in the United States. We got CMV titers. IgG positive. IgM positive, 3.44 with the index greater than 1.11. He felt fine. He was not fatigued, wasn't in bed, was going to work every day, going to the gym, working out 3 days a week. This is relatively asymptomatic. But what I showed you before, people who have CMV have shorter telomeres. His CMV DNA, since the syllabus was done, has come back negative. We talked about safer sex guidelines. CMV can be transmitted sexually. He's currently monogamous with a girlfriend, but we talked about it. And he was started on telomerase activation supplement, 250 units, 2 twice a day. The question comes up, what is the relationship between this and his apnea? Because remember I told you sleep apnea is associated with shorter telomeres, although he's using his CPAP machine and the chip measurement shows that everything's working okay. Perhaps the years that he had apnea when it was undiagnosed led to a decline. And then just the last thought, he has Peyronie's. So we talked about pulmonary fibrosis, shorter telomeres, cirrhosis and fibrosis, shorter telomeres. So Peyronie's disease is another fibrosis disease. You go to PubMed and enter in telomeres, telomerase, and Peyronie's, nada. Nothing comes up. So how to keep your telomeres long, healthy lifestyle, exercise, stress management, healthy weight, healthy nutrition, fish oil, multivite, vitamins, antioxidants, baseline testing for telomeres, immune subset testing, lifestyle again, hormone replacement therapy when indicated, estrogen, progesterone. I didn't tell you, progesterone actually downregulates telomerase. So as you've heard many times, hormones have to be in balance. So you would never want to use estrogen alone, even in a woman who doesn't have a uterus. Growth hormone, of course, if indicated, will help to extend telomeres. Telomerase activation when indicated. So final question. Would AOS want Tithonus to have a telomere test? Yes. Would AOS want Tithonus to take a telomerase activating supplement? I hear some yeses. Not everybody's convinced. Who should have telomere testing, antioxidant inflammation testing, age management testing, bioidentical hormone replacement, telomerase activator? Again, it's all about quality of life, delaying and preventing disease, health, wellness, and disease prevention. So this is Dilbert. We're looking for engineers with short telomeres for their age. That's an indication you value work above exercise. But you have a company gym. That's our slacker trap. Thank you very much.